Good morning, students. I welcome you to AIIMS Model Recall November 2018. I am Dr. Will Morgan. You are meeting me at Community Medicine with Wales. So the first question was, in a research conducted at AIIMS, systolic BP was measured between two different groups after treatment. So what is the test of significance to be used? So what can you understand from the question? So the variable is systolic BP. So what type of variable is this systolic BP? So totally variables are of two types, quantitative and qualitative. So quantitative means it's a quantity which can be measured using a scale. For example, systolic BP, it can be measured using a scale that is like a sphygmomanometer in millimeter of mercury. Qualitative means they cannot be measured. So what is the example? Like your sex. Like for example, we can take sex two types, male, female. Then Kupusamy socioeconomic scale, upper class, middle class, lower class, so on. So like this, in qualitative data, we cannot measure, just we can maybe able to count like two number of males, three number of females. There is no scale. So here the data is quantitative. Then it was measured between two different groups after treatment. So the number of groups is 2. So based on the type of data and based on the number of groups, we have the test of significance. See, the quantitative data are measured using parametric test and the qualitative data are measured using non-parametric test. So quantitative data, parametric test means the distribution will be normal. The qualitative data or non-parametric test means the distribution will not be normal. It can be Poisson or any distribution. So parametric tests mainly use tests are 3, unpaired, paired and ANOVA. So when there are only two groups, we use either unpaired t-test or paired t-test. When we do like a research in twins or two groups of identical persons or the research on same person before and after giving a drug, they are like twins or the same persons. So that is called a paired t-test. So when we are doing in two different groups, independent groups, it is unpaired t-test. So when we do it on more than two groups, then it is called ANOVA. ANOVA is nothing but analysis of variance. That is the variation between the groups. So in our study, so we measured between two different groups. So the answer is unpaired t-test. So for qualitative data, we have chi-square test. And if there is some order, we can use Mann-Whitney test, or if they are paired, we can use McNemus test. So next, a similar question. In a research conducted at AIIMS, systolic BP was measured in the same group before and after treatment. What is the test of significance to be used? So the data now is quantitative, same group, so it is paired. So the answer will be paired t-test. Next, one of the following is true in this diagram. So here we can see a normal distribution curve that is in the red and then a bimodal curve that is in the blue. If you see the normal distribution curve, all the mean, median and mode, they will be the same and they will be in the center. All the three, mean, median and mode, will be the same and will be in the center. But if you see in a bimodal distribution curve, so what is mode? Mode is the most frequent number of observation. Like we are putting vote for 3 persons, A, B, C. So A is getting 1, 2, 3 votes. B is 1 vote. C is getting only 1 vote. So mode is A because he is the most repeated number. So which is most repeated is a mode. So it will be at the top of the curve. So mode will always be at the top of the curve. So this is a bimodal distribution. So this we can see in diseases like Hodgkin's lymphoma because it occurs in two age groups, like in 20 years and at around 60 years. So it is called bimodal distribution. So if you see in this diagram, we can note, so the modes are different, but the mean and the median can be the same. So the answer will be mean is equal to median but not equal to mode. So going to the next question, all of the following are true about this diagram except. So we can see this diagram, it is nothing but it is a box and a whisker plot. How will you tell it is a box and a whisker plot? Because this is a box and these are the whiskers like the ends. So when you get a box and a whisker plot, you should know. So you can just change the diagram into this direction. So just rotating it. So we can see this box and a whisker plot, it has 4 parts. 1, 2, 3, 4. Suppose you are living in a room. If you want to divide the room into 2 parts, you will draw a line between. Here the box and whisker plot, we are dividing it into 4 parts using 3 lines. Okay, we are dividing into 4 parts using 3 lines, that is Q1, Q2, Q3. So Q1, Q2, Q3. So Q1 is the lowermost, Q2 is the median, so the center is called as the median, and Q3 is the uppermost. So each will have 25% of the values. So totally we will have 100% of the values. So what is this graph? It is negatively skewed or positively skewed. So this we are drawing. It is nothing but it is a long skew towards the right hand side. So it is positively skewed. So this graph is positively skewed. Then we come here. 75% of the values are about 25 mg. So here this is the 25 mg. So each will have 25%. So that is also right. So 75% of the values are above 25 mg and the median here, center line, it is 50 mg. So the answer is it is negatively skewed. So how will you tell when 2 screening tests are done in series, the result is? So first you have to understand what do you mean by doing a test in series and what do you mean by doing a test in parallel. Suppose we can take myocardial infarction. There are many tests like ECG, echo, and there is coronary angiogram. So what a series means, you will go from one test to another only after the first test is positive. If only the ECG is positive, we will go to echo. If only the echo is positive, we will go to coronary angiogram. So this is called test in series. But what do you do for test in parallel means, for test in parallel, you will do everything once the patient gets admitted in the hospital. Suppose the patient gets admitted now. From one hand you will take the ECG. From another side you will try to do the echo. Then another time they will try to put the tube in and try to do the coronary angiogram. And if in any of this there is positive for MI, they will declare it as MI. But in series, only when the first is positive, so they will go to the next. So what happens when the tests are done in series? We will miss many patients who are MI because the ECG was negative. So there is a chance of decreasing in sensitivity. Sensitivity is finding out all the true cases, finding out all the true positive cases. So there will be a decrease in sensitivity. But at last, the patient we get after all the 3 tests, he will truly will have almost 100%, he will have the heart disease. So that will be more specific. So when you do a test in series, there will be decrease in sensitivity and increase in specificity. So in order to remember this, there is a easy table. So you can remember this table: tests in series, tests in parallel. That is a combined sensitivity. So when you do the test in series, the combined sensitivity, it decreases. The combined sensitivity decreases. So you know standard deviation, so SD. So you remember the standard deviation is D. So for combined sensitivity, when doing test in series, that is series decreases, series decreases. What happens to the specificity when you do for the test in series, then it increases. So always you remember the sensitivity comes first. In alphabetical order, E comes first, then only the P comes. So you remember only as SG alone. So combined sensitivity for test in series, it decreases. For test in series, combined sensitivity decreases and the combined specificity, it increases. So going to the next question, the following is used for treating. So we have many diseases. When you look at this, you can see there are white color and brown color tablets. So this brown are capsule, the white is a tablet. So these are for leprosy. So this green strip is for paucibacillary. And if you see this strip, it is for multibacillary. It is mainly used for leprosy because we have the brown color capsule is nothing but it is clofazimine. And the white color is nothing but it is dapsone. And here we have another two tablets, that is rifampicin. This is for a monthly strip. See, that will be for 28 days. These tablets we will take on the first day. These tablets we will take from the days 2 to 28. So first day we will take 2 capsules of rifampicin, then 3 clofazimine, then 1 dapsone on the first day. Then in the remaining 2 to 28 days we will take these tablets and capsules. So this is used for leprosy. The next is the disease cycle expressed in this diagram. So what are the chances of disease transmission you can see in this diagram? First, you can see there is a man climbing up a palm tree. So there is a spread from the palm tree. Where does it spread? It spreads from bats to the palm tree fluid. It is used for drinking, like kallu, they will tell, no? It gives a bit of mayakam. So the palm tree, it gives kallu. So it is from bats. This, when the man drinks, it can go into the humans. So the chance of transmission is from bats to humans. And then it can also spread from human to human. Then it can also spread from pigs to human. So this is seen mainly in Nipah virus. So it can spread from pigs to humans, then from infected bats to the fruits to the humans, and then in between humans to humans. So how it spreads from bats to humans? Mainly either to the palm tree fluid, or it can also spread through fruits. It spreads from bats, can spread it to humans through fruits or through the palm tree fluid. Then directly from pigs to humans, and direct transmission between humans to humans. So it is a paramyxovirus. It emerged in Malaysia. So what is the long-term sequel of this is, it mainly leads to neurological complication like persistent convulsions and personality changes. Long-term, when it remains inside our body, it can result in reactivation later. So in Malaysia and Singapore, it spread mainly by close contact with infected pigs. In Malaysia and Singapore, there was no person-to-person transmission, but in other areas, there are person-to-person transmission. This person-to-person transmission has been reported in Bangladesh and India. It is mostly seen in the family and caregivers of Nipah virus infected patients. So we can see the consumption of raw date palm sap, which is usually contaminated with bat excretions. So the diagnosis is mainly by RT-PCR. Later stages, antibody detection by ELISA. Then treatment, it is mainly supportive treatment. Vaccine is on the pipe. Next, what does this symbol denote? You can see what is this. It is some like light. So you have gone to a lighthouse. The lighthouse. So it is like some light hazard. So light, we can remember it as radiation. Light or radiation. On a yellow color background, there are black color light spreading. Radiation hazard. How can you differentiate it? Usually for agent of bioterrorism, there are no specific symbols. But there are symbols for biomedical waste, that is cytotoxic waste usually. So this is, we know, this is the answer, radiation hazard. This stands for biohazard. It will be in the biomedical waste management bags, you can see. It will be like some Chinese claw symbol, like a claw, 3 claws. Okay, this is bad, a bad omen, like biohazard. C stands for cytotoxic hazard. Next is what is spikes protocol. Spikes, it is a new question. It has not been mentioned in any of my notes. All other questions have a brief mention in my notes. Except for this question, it has never been given in my notes. The spikes protocol is for breaking bad news to the family. So what you understand by spikes protocol is, you can expand the term spikes. S stands for setting up interview with the family. That is, before telling them, sorry sir, your father has gone to God, or your father has died. Before telling them, how to tell them, there is a protocol, that is spikes protocol. Setting up interview with the family members, then assessing their perception, how is their mood, by asking open-ended questions. Then we have to ask how does the family situation is there, how they want to hear the information, that is the invitation. Then we have to share the knowledge in terms of non-technical terms in which they can understand, and we have to see their emotions and we have to respond it, and then we have to summarize it. This is the spikes protocol. Next is maternal mortality ratio. It is expressed as, so usually maternal mortality ratio, so you have the term called ratio. What is the important thing with ratio? In ratio, the numerator is not a part of denominator, but in rate, the numerator is a part of denominator. For rate, the example is infant mortality rate. So number of infant deaths by live births. So if the children are being born only, they can die. So if they are being born only, they can die. So the deaths, they are a part of the live births. But if you see maternal mortality ratio formula, it is the number of women deaths per 1 lakh live births. Because it comes in decimal points, if you put as 1000, so they are expressing it as always as 1 lakh. It is standard for all over the world. Then only we'll get some numbers like 150, 200. So only they are expressing it as 1 lakh live births. So what is maternal death is? Death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy. That is mainly due to the causes caused by pregnancy or other adjoining causes. We should not include accidents into this. So the answer will be maternal mortality ratio is maternal deaths per 1 lakh live births. See here it is maternal woman, here these two, they are like rate, because numerator is a part of denominator. So these two are the possible choices. In this we have per 1 lakh. Next, midday meal program. It is an easy direct question. It provides 1/3 of the daily energy and half of the daily protein requirement. So the daily energy and daily protein, in this 1/3 of daily energy and 1/2 of the daily protein will be provided by the midday meal program. It is like it is only a supplement. It cannot replace our food. It is only a supplement to the child's food. Then in the national immunization schedule, all the following are given except, so you know, measles is given as 9th month, and also a booster is given. It is given either as measles or MR. Also it is given at another dose is given between 16 to 24 months. So influenza, it is presently not in our national immunization schedule. Rotavirus, it has been included in our schedule at 6, 10 and 14 weeks. Then Japanese encephalitis, it is in our national immunization schedule, especially in endemic areas like in Assam and in other areas. It is in our national immunization schedule. Influenza, it is not in our immunization schedule. So this is our immunization schedule. We can see rotavirus 6 weeks, 10 weeks and 14 weeks. Then measles or MR, it is given at 9th month and second dose at 16 to 24 months. Then if you see Japanese encephalitis, first dose at 9th month and second dose at 16 to 24 months. Now there is no influenza vaccine. So recently there was spread of swine flu. So they were all putting live or killed vaccines. It is not a regular in our national immunization schedule. Next, blood banks after transfusion are disposed in. So when you hear the term blood, so what you see in the blood bags, there is blood. So after transfusion, it has become soiled. So the blood bag is soiled with blood. So whatever thing which is soiled waste, it should come under yellow color category. Soiled waste, it could come under yellow color category. For easy remembrance, blue, it mainly stands for glassware. And then body implants. White for sharp items like the needle sharp. Red for rubber and urine bags and other plastic bags. But if they are soiled, it should come under yellow. So this is yellow, red, white, then blue. Blue along with glassware. It can also include metallic body implants. Red mainly for contaminated waste like tubes, IV tubes, then the bottles, then the catheter, urine bags, gloves, everything comes under red. Red usually stands for recyclable waste. Yellow mainly for soiled waste, that is human anatomical waste, animal anatomical waste, soiled waste like the product of MTP. After doing MTP, which bag you will put? You will put only in yellow bag. That is a human anatomical waste. It also includes microbiology, biotechnology and clinical lab waste, chemical waste, and discarded medicines or expired medicines should also come under yellow color bag. Next, the following is true regarding MDR-TB treatment. So in multi-drug resistant TB treatment, we will give 6 drugs for 4 months, 6 drugs for 6 months and 4 drugs for 18 months. So totally it will be for minimum of 24 months. So you would have all seen the Padmavat movie. So the mnemonic is kill Z. Kill Z, you can remember it like kill Z. So 6 drugs, kill Z. Kanamycin, levofloxacin, cycloserine, pyrazinamide, ethambutol and ethionamide. So you have 6 drugs for 6 months, maximum of 9 months. Then 4 drugs for 18 months. So this represents the months, 6 months, 18 months. That is levofloxacin, cycloserine, ethionamide and ethambutol. So 6 drugs for 6 months and 4 drugs for 18 months. So kill Z, LZ. So it is kill Z, it is LZ, LC. So the next question is, what is the 11-hour gestral dose for emergency contraception? So the usual dose is, first we have to take the 0.75 mg within 72 hours of intercourse. Then the next 0.75 mg within 12 hours of taking the first dose. So the answer here is 1.5 mg in 2 doses. Recently There is also another way. We can take the whole as 1.5 mg within 72 hours in a single dose. The total dose should be 1.5 mg. Next is phase 1 clinical trial measures. So clinical trials are nothing but usually they are randomized controlled trials. So in clinical trials we have many phases: phase 1, phase 2, phase 3 and phase 4. Usually the RCTs usually refer to the phase 3 of the clinical trials. So before coming into the human trials, they will do it on animals and it is called animal trials. So in phase 4, it is, you all know, it is post-marketing surveillance. A drug after comes into the market, they will do surveillance, maybe from the medical shops, to which person it has been distributed and how much side effects, the rare side effects after. For a diabetic drug, a rare side effect of urinary bladder cancer was reported from the post-marketing surveillance several years, for 10 years after marketing. Then the phase 3, it is usually for all the things like how the drug is effective. So is there any toxicity with the drug? What is the side effect of the drug? The phase 1, it usually leads to the safety and toxicity. Phase 1, it is mainly done on healthy human volunteers. Only from the phase 2 to phase 4, it is done on patients. Phase 1, it is done on healthy human volunteers for the safety and toxicity of the drug. Phase 2 also leads with the efficacy and effectiveness of the drug. So the answer here will be phase 1 clinical trial measures safety and toxicity. Next, period of isolation for measles is from. Usually in measles the incubation period is 10 to 14 days. That is 10 days for appearance of the general prodromal symptoms like fever and other things, and 14 days for appearance of rash. So usually measles will be communicable 3 to 4 days before rash and 3 to 4 days after rash. So isolation we will do only for deceased person. So only after the disease comes or the symptoms comes he can know. So this isolation will be from the onset of the symptoms to 3 to 4 days after the rash. Onset of the symptoms to 3rd day after the rash. So isolation means separation of the deceased persons from coming into contact with other healthy persons in order to prevent the transmission of the disease. There is another word called quarantine. So quarantine, it is done for healthy persons who have had exposure to a disease. So quarantine is done for healthy person, isolation is done for deceased persons. Next, in a PHC, usually 30 to 40 cases of dengue occur in a year. In 2017, 38 cases were reported. So in a PHC now 2018, there were 30 to 40. So in 2017, it was 38. So they are almost the same. When the same number of cases occurs in usual occurrence of number of cases occurs, then it is called endemic. Occurrence of number of cases in usual numbers. Epidemic means suddenly in 2018, 100 cases or 60 cases, which is more than 2 standard deviation above the mean. When the sudden increase in the number of cases, then it is called epidemic. Pandemic is nothing but an epidemic occurring all over the world, like America, Africa, Australia, everywhere. Sporadic is a single case occurring elsewhere, very, very rarely, without any pattern. So here it is occurring almost the same. So here the answer will be endemic. Next, according to Mental Health Act 2017, based on WHO Mental Health Action Gap, all the following are included except. So here the WHO Mental Health Action Gap. What do you understand by it? This WHO Mental Health Action Gap or the WHO Mental Health Gap Action Program, it was developed mainly for developing countries, low and middle income countries. They give services for mental disorders, neurological disorders and substance use disorders, like those who are suffering from addiction to smoking, alcoholism, schizophrenia, and then those who have suicide tendencies, they mobilize them, and then they give inpatient and also outpatient treatment. And they also give them psychosocial support to their family members. If you see diseases like depression or mental disorders, they are like non-communicable diseases. So they will not screen the family members. They will give social support, they will give outpatient and an inpatient treatment service, they will give psychosocial intervention, but there is no need for screening the family members. If you go into the iOS and Android, there are apps for the WHO mental health gap. They give directions and training. This application, it is available on both iOS and Android with regards to mental health action gap. Then we come to the last question. So BCG gives highest protection against which type of TB? If you see BCG, its efficacy against pulmonary TB is almost nil in some studies. It ranges from 0 to 80%, but it is almost nil in some studies. So multi-drug resistant TB. So if it is nil for pulmonary TB, then it is also nil for MDR-TB. Then disseminated TB. The main purpose of giving BCG is to prevent the dissemination of TB, mainly to prevent the meningeal TB and spreading to other parts. So the correct answer will be the CNS and disseminated tuberculosis. So BCG, it is also said to give protection against bladder cancer. Thank you.